So if you look at the agenda for this session, it's called Future Vision, Audience Debate on the Lessons from the Empower Health Conference. Now, we have a message, a video message from the Commissioner. So what I'm going to invite us to do is we're going to watch that video message, and then I am going to turn the microphones over to you. And my task is to have a conversation with you, and we will co-design our ambitions, our regrets, our plans for the future, and see where we go. But let's start by watching the message from Stella Kyriakides.
Ladies and gentlemen, let me start by warmly congratulating the European Public Health Alliance on its 30th anniversary. An anniversary that reflects your determined work, cooperation and partnership in Brussels and all over Europe. The title of this conference, Empower Health, could not be more appropriate. And that's exactly what we need to do. Empower health for us to become stronger and more resilient as a continent. I know the essence of this slogan for many years, but we have all come to experience its necessity so much more in recent years. When I assumed the role of European Commissioner for Health and Food Safety in December 2019, I could not imagine the events that were about to unfold. Within a few short weeks, an unprecedented global pandemic would take its grip, irreversibly changing the world as we all knew it, and leaving no country and no citizen untouched. But despite these difficult circumstances, the EU and its member states managed to come together to solve our common challenges and created a united response based on a strong coordination and solidarity. Since then, the creation of a strong European Health Union broke down many taboos when it comes to EU health policy and is bringing clear added value to member states and our citizens by building more sustainable health systems that deliver for them. Each of our health union's pillars, from the ambitions Europe's Beating Cancer Plan, to the pharmaceutical strategy, to a world-pioneering European health data space, and our comprehensive approach to mental health, together with a stronger EU health security framework, are bringing results on the ground. Throughout the pandemic, through our vaccine strategy, we ensured equal and simultaneous deliveries of life-saving COVID vaccines to all 27 member states. The EU also became the world's pharmacy during this time, exporting billions of vaccine doses all over the world. Our work on vaccines is the most tangible and visible example that we can achieve the impossible, even in areas where we have little competence, if we rally around a common goal. Throughout these last years, I could count on you, but also many other civil society organizations working on health, for your expertise and partnership. And I thank you for this. And this is my message for future health cooperation. We are stronger when we work together. And we can only build stronger and healthier societies if the spirit of cooperation and solidarity we saw during the pandemic prevails. This is our duty to our citizens. This is what we must deliver for them and for generations to come. And it is also the very essence of the European Public Health Alliance work. I wish you all the success in the future and the closest possible collaboration to continue to make a difference.
Thank you very much. Now, it's a little misleading, this picture here, because that looks like I'm going to invite all of my former moderators to come back and join me on the stage and we'll have a little conversation. That's not actually what's going to happen. I'm going to throw the microphone open to the room and I want us to reflect together. What did you hear that inspired you? What did you hear that challenged you? Have you got something that you think I need to do differently? I want to take forward. because we started the day by looking back over the last 30 years, the 30 years of IFA's existence, and we celebrated the community that's been built, and we acknowledged the progress that has been made in institutions and processes and legislation. We also started to talk about some of the failures and the gaps. We've discussed how to engage and empower civil society, how to build evidence and achieve policy change. We heard stories of how policymakers at local and national level can be motivated and pushed towards change. So this is where we are now, but we're now trying to look forward. Where do we go from here? IFA needs to build a resilient organization and a bold, empowering vision for the future. And you are part of that process to help make it happen. So I have colleagues who have microphones, and we have a microphone over there. We have a microphone over here. This is now your time. After everything that you've heard today, where do we go from here? What would you like to say? What has inspired you? I can show you the Slido polls that we had that had lots of important words in here. I might also like to use something Frank said on that last panel. You know, we need to be more angry. Why are we too reasonable? And we need to not fall back into complacency. The challenges that we have now in front of us are perhaps greater than they have ever been. Do we have the right response? Are we up to the challenge? Climate change is extraordinary in what it's going to do to us. We talk about COVID-19 as being a transformation event, but climate change is happening to us also as a transformation event, but not as fast or not in the same way we recognize, but nothing will be the same. We're perhaps beyond the tipping point. We might also want to talk about the pace of change of technology, the importance of a new term that's coming forward of cognitive sovereignty. Does anyone know what I mean by cognitive sovereignty? This is the way that increasingly we can, as individuals, be manipulated by disinformation. The ability now for artificial intelligence to create deep fakes that are so realistic, it's hard to say what the truth is anymore. And if you think that everything we've talked about today is about public health coming together with community, and as communities agreeing on what our values are and how we go forward, but that has always assumed that there is a subjective and objective reality that we all agree on. That may no longer be the case in the future. It's already the case when we've seen elections change by personalized advertising on Facebook and others. What's increasingly happening with the new AI tools is they can create very quickly personalized videos to market. There's an American car brand that created 1.2 million personalized videos, and for each of their customers, and it scraped information from their social media profiles and others, so they were able to generate a personalized video showing them driving through their local town with all the things that they cared about. Dogs, there'll be a dog walking beside them, and they could do that quickly and easily. No one else is able to do that yet, but imagine if our world is increasingly lived online and we don't interact with its people, and all of that power is in the hands of corporations or political parties that want to manipulate that. I've got a hand up. Somebody wants to comment on that already. Great.
Does it work? Yes. Hi, I'm Elisa Baldini from Eurocam. It's just a reflection on after the very enlightening speech of today. If I look at the time after COVID, for me, I see a polarized society and polarizing positions. And in a way, for me, the role of us, civil society organizations, is not to fall into a black or white, not to fall into one of the poles, but really trying to explore what's all the gray areas in between. You said there is one reality. For me, when it comes to the health sector, that's particularly true. There are many realities. We all feel our health in a personal way, and for us, that's real. People that fall into one pole or the other, maybe they fall into a polarized position because of fear. And fear is a human feeling, and we have to address that cause of fear. So for me, civil society organization fighting for or protecting and promoting the right to the highest sustainable standard of health has from one side to listen carefully to all these people that might have polarized position and try to understand why they have so. And on the other side, they have to be bold and keeping the governments accountable when they say information that then the following day are completely changed, and to keep a historic memory of what government have said and what when decision makers take a decision or make promises to keep them accountable. So for me, the next 30 years of and beyond of IFA, I think that's really the role that IFA should perform, trying to explore this gray area to promote the right to health. Thank you.
Thank you very much. So to avoid getting polarized into a binary black and white world, to acknowledge the gray areas and the specific realities, and not to allow fear and uncertainty to guide what we do. Thank you. Who else would like to share? Yes, thank you. We'll bring you the microphone. It's arriving.
Yeah, hello, my name is Nora Laubstein from ENMI, Association for Natural Medicine in Europe. When I see the first Slido, I see it was the first, everyone is exhausted and not a little bit depressive or pessimistic or so. The second Slido was, what's the solution? It's about funding. And the third Slido was, what's the greatest barrier? Capitalism. I think when you put these three Slidos in one row, it's really interesting to given what's in our brains. Sometimes money helps, sometimes money is the barrier, the capitalistic. I'm not sure whether all the 30 years of IFA will present really all stuff, all content of the members, of the membership. Because now our organization is 20 years and happy birthday to IFA, and I would like to join IFA in the next time too. But the possibilities of traditional and complementary medicine and the ideas are not so included until now. A lot of people know it, the citizens know it, and an easy language to understand, that the people understand what the politicians want. I think this is a really big barrier. Also, the consciousness, what means health. This is a big barrier to build up consciousness for the people and to be understandable. I think this could be, for me, an important input for the future.
Thank you. I want to pick up on the session where we talked about power and politics and populism. And I was talking to Peggy just before, I don't know where Peggy is, just before she went on stage. And we talked about, how does populism come in? And we talked about the fact that when you have traditional parties that have lost the trust of the population, then it's very easy to follow the rhetoric. Jonathan, the panelist, said, populism comes in by dividing us into two. There's corrupt elites who are out of touch, and there's us, the champion of the noble, valuable people. And I wonder how you think we are as public health community. Over the last few years, there's been an enormous drop in trust, drop in interpersonal trust, a drop in institutional trust. And now if we need to rebuild on that, because we see that there's a danger for populism, how do we rebuild trust? And everything that we do as a community is around, remember the several of our panelists said, it's diplomacy of cups of tea and cups of coffee, one at a time, going to see different departments and bringing them on board and finding out what they need, and etc. It's building that network of relationships and trust that has been so destroyed over the last 2 years, where we've had countries where it's been clear that and this is the UK, the leaders told people to do one thing and did something quite different themselves. Other countries where contracts were awarded in very untransparent ways. So how do we rebuild trust, because we have nothing as a public health community if we can't have that. We talk about speaking our truths and putting the evidence forward, but that has to be done in an attitude of trust. Does anyone have something they might like to say about that issue of rebuilding trust? Yes, we'll get you a microphone.
Hi, my name is Philip. For those of you who know me, I'm an IFA alumnus. I used to work at IFA for more than 2 years. I would like to say that I think one of the other challenges that unfortunately we have is that a lot of these ideas is perceived to be belonging only to the left, and sadly we see that even things like public health have been very politicized, and we have people on the left and on the right. And I think that was seen quite well during the COVID pandemic, where those who, let's say, were more against COVID measures and the vaccine tend to fall on the more right side or more popular side of the spectrum and so on. And I think in this, we have the challenge of maybe making these, what I might call leftist ideas more understandable to the people, because we often use a lot of terms in, let's say, leftist circles like intersectionality, social determinants, commercial determinants, and a lot of right-wing populists like to use very simple and very direct terms. For example, if we think about migration, they're going to say, oh, these people are stealing your jobs. And that's much easier to explain to someone than to say, well, as a result of your upbringing and the social class you were born into and the opportunities you had, that gets more complex. So I think we, let's say on the left, need to get better at kind of creating simple yet effective messages that the masses will kind of understand. I think that's also where a big part of the issue lies.
Thank you. I think you're right in saying that the language that we use is really important, because one of the threads I think that went through all of our panels is the power of narratives and storytelling, whether it's putting the evidence in a concrete way or getting the right people around the table in order to pass your message. The importance of narratives and language is really key. Let me add something else challenging for the end of the day, which is from a public health perspective. What is our view of the state? We celebrate the fact that in Europe, it is the only continent in the world that attempts to deliver universal healthcare, free education. We're very proud of the fact that one of the defining features of Europe is a welfare state. But for many people who are currently in our society, the state, their experience of the state is not one of protection. They don't see the state as a guarantor of their human rights. They see the state as an oppressor. Their experience is of violence. When you look at austerity measures and people are facing eviction and they're on 0 hours contracts, or if they're from an ethnic minority background and the police are checking them all the time, their experience of the state is not one of empowerment. It's not one of protection. It's not one of a guarantee of security. And I think there's also a generational divide. The COVID generation, whose education and whose first attempts at the job market were interrupted by lockdowns, that same generation who will never have the money to buy a home or have the kind of long-term protection that my generation enjoyed, or access to free education. We have to be very careful about how we express what the government could provide, what it should provide, its role in developing an enabling environment for health, because that may well be our experience and what we expect, but it is not the experience of everyone. And Frank put forward the experiences of trying to advocate for homelessness. And I loved the way he said it. It's easy to get his issue on the agenda because homelessness is irritating. But what you end up getting is then a punitive response. And when we look at the future that's coming forward, large numbers of people on the move as a result of conflict, as a result of climate change, we have austerity and poverty measures, you have young people facing an enormous economic burden. What is our vision as the public health community of what we want the state to provide? What should be the role of civil society? Are we in opposition to the state? Are we an implementer of the state? Are we holding the state accountable? Do we want it to do more? These are questions, hard questions that I invite us to reflect on, because I've been in many conversations where NGOs who sit in policy environments in Brussels are seen as part of the problem. We are part of the out of the touch elite if we can't acknowledge the voices from the floor. So I was asked by Milka to make sure that this final session was challenging, provoking, and allowed us to reflect on what we've heard. And this is what I wanted to put forward to you, because I'm questioning that myself. Because my point of view, from my perspective and my experience, has always been the government should do more. It should provide more. It should be the guarantor of certain things, because that's what I've experienced in my life. I have not experienced violence from it. Yes. Yep.
Smina, I'm a new member, a new employee of IFA.
Is that microphone working? Can we just see what number's written on it? Number 8. Try again.
Hello. I can be loud if you need. Okay, yes.
Yep. Go ahead.
So I would like to say, I want to reflect back what I want to mention. I want to say something earlier, but this brings me to a new topic, but still the same thing regarding youth. And as somebody who couldn't answer your question earlier, on reflecting back on 30 years of European public health, as a 26-year-old, it was impossible for me. But what I can say is, in the future of public health in the European sphere, we need to involve youth, and youth need to be there to change, to drive leaders to make these different decisions that include the entire society, because the youth are not only the present, but they're also the future. And prevention is a major part of public health, as you all may know. So this is a part of prevention. This is a part of making sure that futures are prepared and that youth voices are heard, because they are also minorities, women, the LGBTQ plus communities, those that are really unheard of nowadays. So my challenge to public health leaders now is really to make sure that youth voices are heard and that they're always involved.
Thank you. I've got a hand up, another hand up. Okay, so we'll keep the microphone going. We'll start here and then we'll come at the back to Claudia.
Thank you very much for the question, Tamsin, about stage, but I'm not quite sure I will respond to this. I think there's few things that I would like to say at the end of the conference. The first one is it's very difficult for me to respond to the question because in 30 years, I'll be 90 years old. I hope I'll be there, but what I really want to say is to absolutely applaud the participation of the young people actually here. We've heard an amazing moderation from the lady from the European Youth Forum, not the European Youth, YHO. There are many amazing leaders. This gentleman behind had the strength to say something that, if I look back 30 years, no one in the public health community would have dared to talk about, and that is talking about the left, which I think it's a debate that needs to be had. It's not resolved. I also want to say that, so the only thing I can say is the past 30 years, and I really want to celebrate IFA. And the issue of funding is something that cannot be avoided. And because IFA in the past 30 years has sort of managed to face adversity with very often no funding, and it's been a constant battle. The issue of funding is a question of democracy. And it's not an issue which is going away, I'm afraid, because we will be facing very soon another funding crisis for civil society, and civil society as a whole is being attacked. And the last thing I wanted to say is to thank the entire IFA team for this meeting today, because it's not easy. Even today, in the face of adversity, what has happened with this new team is it's amazing. It's an amazing IFA team, an amazing IFA leadership. So I really want to thank them. And I'm sure that the young people will take us through the next 30 years, but they need to have a voice. So they should be invited to speak and not us. I've spoken too long.
Thank you. And then I'm coming to this side of the room. Okay, Claudia. Sorry, no, please go ahead.
So I just wanted to make a very quick comment about something that I think, so you talked about universal health coverage and what state can do to ensure it. And I think that that is diverse, obviously, given the devolved nature of health in Europe. But I think that there is a loud silence about racism and discrimination. Two tragic events happened, when the submersible to the Titanic, imploded, and at the same time, there were 750 people, I think, who died off the coast of Greece. And one was kept on the news for days, and the other one was not even mentioned. And we see that over and over and over again. Some of this negativity is propagated by the state, ministers, for example. And I just think that we need to look also at how Europe is treating migrants. So we know very well that, with the tragic situation in Ukraine, and how Europe has opened up its borders to Ukrainians who are running from conflict, who are affected. But at the same time, we have African migrants who are running from conflicts in places like Sudan, and they're undesirable in Europe. So I think that we also owe it to ourselves as well to be champions to speak for those who are not able to do so, because we can't pretend that we want to reach excellence when we know very well that a significant portion of the population in Europe is not being spoken for. So I just wanted to raise that. Thank you.
Thank you. Claudia, and then I'm coming to this side of the road.
Thanks. I wanted to go back to the fact of the role of the state and the trust of people, and we touched we touched upon it during the second session today, and it is the concept of co-production or co-creation. I think that basically there are two things. First, that we need really to move towards real co-creation. So not just I've consulted you, tick the box and we go ahead. And unfortunately, also in institutions, often that is still the case, not always. We are seeing good changes, but that is still the case. And that is one important point. And then the other point is that when we talk about education, which was the second thing after funding that came up, let's remember, it is not just education, let's empower those people that are there and that they could then be able to talk to us. No, you really need to educate in the States, the policymakers, the service providers to listen and to actually put aside egos sometimes and really realize that there is a lot of expertise from the ground, that the people with lived experience have real expertise. Expert by experience, as we would, not everybody is necessarily an expert by experience, but this is really important. And that is also how you get the trust back, because then you get the buy-in into your actions, into your policies, and into your practices.
Thank you. Yes.
Well, thank you. The first thing I have to say is to thank to the organizers for this very interesting conference. So many things, many thoughts. I'm going to say 3 or 4 thoughts that may be useful for the conversation, for the discussion. The first one, of course, is that we have to be proud of what we have been achieved. Certainly, this is always very important. At the same time, I think it's always important not only what we have achieved, but what we could have been achieved. It's like when we think, okay, there is a reduction of poverty. Yeah, but it could be better. It could have been better, this achievement. That's very important, given the resources, the opportunities, the power, etc. The second point I want to make is about language. It has been said something about language. I think language is so important because it frames our discussions, right? The words, the concepts. So for example, just to give a very quick example, why civil society? Why not social movements? And different types of social movements. Civil society, in my view, is too vague. Why globalization? Why not neoliberalism, which has been dominant for 40 years, 50 years, with many policies very well studied, many bad consequences in general, right? Why populism? Why not almost right-wing neo-fascism? That's what we are experiencing. I mean, historians may discuss, details about this, but, words are important. The third thought is that I think we need to go deeply into the root causes. Some people have said that several times, as to the whys, these causes of the causes of the causes, right? Because that frame many of the problems, many of the effects So for instance, climate crisis, very important. Why not ecological crisis? We have a lot of evidence of what's going on in the ecological crisis. So it's a mix of many things. It's a poly-crisis, it's eco-social crisis, actually, biodiversity, crisis of energy. This is going to drive many of the problems we are going to see in the next few years, decades, actually. So this ecological crisis, which goes much beyond climate crisis. Again, climate crisis is awful, of course, but behind that, there is also the issue of structural social determinants of health. I mean, a lot of discussion about the politics, right? About politicians, etc. But look at what many people said in the room. Capitalism, yeah? Well, it's not a bad word. It's the system where we live, right? We need to understand somehow capitalism. And we have very good studies. A lot of scholars have been studying that. It's not easy to change, but at least we need to be aware and understand things like, for example, growth. Economists, for the most part, know nothing about ecology, nothing, almost nothing, because they don't study ecology. This is awful, right? Growth, there can be a growth, constant growth forever. Well, I think it was Kenneth Boulding, he said, economic ecologist, he said, well, the guy who thinks that can be constant growth is either a fool or an economist, right? Because it's impossible in this finite planet in where we live. So we need to change that in one way or another. Let me finish with my final point, which is about the importance of empowerment, right? But where is power? Okay, power is not only in politicians' hands, judges, civil servants, corporations, the media, the military, all of this mix. So we need to think very carefully about where, how, and where to get empowerment, right? And I suggest that, of course, states and governments has a lot to say, certainly, but social movements, and we look at history, we can learn a lot. Feminist movement, anti-colonial movement, ecological movement, workers. A lot of human rights have been gained through all these struggles, all these battles through history. Just, sorry, too long.
Thank you. I'm taking the point that we should, again, take the power. Oh, I've got loads of hands up and we're running close out of time. Let me see your hands up so I know how many people I need to. I've got 1, 2, 3, 4, 5, 6. Okay. Let's start at the back. Yes, go ahead.
Yeah, hello, my name's Fraser Goodwin, and I'm guilty of putting a lot of the content of today's conference together. And I was very disappointed in many respects for one of the sessions that we didn't really hold accountable the Commission when they were here for how well they engaged civil society and civil society comments in policymaking. We let them get away largely with saying that they're doing a good job. And it's because that we were with friends. We were with Maya, who comes from our own community. We work well with her. We work well generally with DG Santé. And we fell into this trap of being much more encouraged by being actively engaged, by being in partnership, by co-creation, than holding people to account and telling friends uncomfortable truths. And the uncomfortable truth is that most of the consultations run by DG Santé are tick box exercises and nothing more. And so we need, if we're going to be determined, we need one more word in this word cloud, and that is confrontational. We need to be uncomfortable and comfortable in moving into beyond our comfort zone. We need to be determined. And you might have heard that I'm not afraid in a room of friends of raising my voice today. Yeah. And we need to bring that notion across the board in our work to make sure that even though we're with friends, to tell them uncomfortable truths and be determined in that way.
Thank you. Yes, go ahead.
Hi, everyone. So I was really interested in a point that you raised at some point, kind of mistrust towards NGOs. And I must say that one of the questions, maybe an uncomfortable question, is like, how are we engaging with grassroots organizations? Those organizations that actually work daily with those people who suffer like discrimination on a daily basis, violence, and so on. Because at the end of the day, a hard truth might be that we are organization NGOs that work in Europe. We want to represent Europe, but how can we be a useful intermediate for those organizations that actually work locally with the actual people? Because even when we collect data, we are collecting data to a certain parts of the population that is that has access to that data collection and to research and is aware of what is going on. But those who are the most marginalized potentially do not even have access to that and are not really the intermediate of our speeches. So we also need to think of, we call them hard to reach people, but maybe we should make a stronger effort on actually reaching those people.
Thank you. Okay, Fiona?
Thank
Please,
you.
go ahead.
I'll be quick. Fiona Godfrey, independent consultant in EU public health. I just want to thank Fraser for what he said about being confrontational with the Commission. A lot of people don't know this, but what struck me when years ago we were negotiating for the Framework Convention on Tobacco Control, at the conferences of the parties meetings and the initial negotiating meetings at the start of this century, we would have the different WHO regions, and every morning and every evening, the different WHO regions, so CRO for South Asia, Euro, Western Pacific, every year, every region would have a meeting twice a day. Every single region, and we're talking about regions which included Iran, China, would allow NGOs into those meetings. The EU would not. I had to go and ask the Russian Health Ministry representative to allow us, as the EU representatives of civil society, to go into the Euro regional meeting. So that tells you a lot about the Commission and the EU attitude towards civil society engagement. If it was worse than China and Iran, absolutely true story. To go back to, thank you for the gentleman over there for all of his comments, and thank you for the question that you put about the role of the state, because I've been in public health for a long time now, but increasingly for the last definitely 15 years, more than that, possibly since definitely 2007, I've come to the feeling that we are in public health, certainly in the EU, here in Brussels. For those of you who follow tennis and Wimbledon, it's a bit like we are playing on the outside court 26 at Wimbledon, which is where public health seems to be located, whereas most of the policy decisions around public health are made on centre court, financial policy, economic policy, business policy. And as NGOs working in public health, we're not playing on that court. We are nowhere near that court.
And we're exhausting ourselves.
And we are
court 26.
Absolutely. And it's raining and nobody's watching and it's midnight and the lights have been switched off. And oh my God, why are we still here? So I think we have to reinvent ourselves. Monica can tell you about the initiatives which are going on here in Brussels and in other capitals and in Geneva and New York and other parts of the world, where the discussions are taking place, which are really going to affect what we're trying to achieve here. And we really, really need to start engaging as a public health community in those arenas, on those policy areas. And then my final point is, and it's related, when I was working for the Union Against Tuberculosis and Lung Disease, funded by Bloomberg Philanthropies for a while, I was a chief grants negotiator for the European region, and I went around different countries in the Euro region negotiating grants and giving them money. And I realized after a while that I wasn't negotiating a tobacco control grant. What I was negotiating was, in fact, in many countries, Russia, Bulgaria, an anti-corruption grant, because what we were trying to do was call governments to account, reinforce democracy, put together anti-corruption policies, rule of law, strengthen the rule of law, and look at political reform on a much, much broader level. And that's also, we have to, yes, we're doing public health, but we have to engage in those fights about democracy, about anti-corruption, because again, if we don't engage in those fights and if we don't win these battles in the next 10, 15 years maximum, everything that we want to achieve in public health will not be achievable. So let's just continue to try and advocate for public health, but engage in those other battles, because then we will also find other friends, other partners, and we will make ourselves more relevant. Because I could do with some water, but one more thing, we've heard a lot today, and I totally agree with how do we reach the people who are disadvantaged, who are not part of these discussions, who we don't work with, we can never reach. And I absolutely agree 100% with that, coming from a very, very poor city, Bradford in England. But I'm also very conscious that my son is 23 years old. He has grown up in Luxembourg, a relatively well-functioning democracy, in a well-funded, comfortable family, thank you, with a lot of privilege, an excellent education, did his undergrad degree in Utrecht in climate science and sustainability. He's doing his master's in global food systems. As he said to me the other day, Mum, I'm a systems guy, and he really is. He really gets it. He really sees what is coming down the pipeline. What Tamsin was saying about climate change, you don't want to have that conversation with my son because it's terrifying. But what struck me on a recent drive a few weeks ago was, despite all of his privileges and his policy knowledge and everything, and having a mother who has stood for elected office to go back to the former mayor of, or deputy mayor of Rennes twice, I'm currently standing as a candidate in the Luxembourgish general election next month, he does not see any role for democracy as it is currently constituted in the European Union. And I'm thinking, well, if he doesn't get it, and he's great on policy, he's got the scientific knowledge, comes from a very political family. If he doesn't get it, and if he sees no future for himself in our current political and economic system, which he understands very, very well, then where does he go? And if he can't find anywhere for himself and locate himself in what we are all doing, what about all the people left at the bottom? So how do we reach those people, and how do we reach out to all the other people, social movements, indigenous communities? How do we reach out to them and put together a package and a message that makes us relevant and allows us to help them and achieve our public health goals? Sorry.
Thank you. Yeah. There's a lady next to you, and then Anne, and then I will bring this to a resounding close. Please.
Yeah. Hi, Anne from EuroHealthNet. I was looking at determined, and I think we need to have a vision, and we cannot only be determined. We need to be something we're working towards to. And I think in order to play in central court, we need to have new alliances and build new alliances. So I think it is very important that we need to look for alliances outside of the normal public health community, in other cities, in with social NGOs, with environmental NGOs, with anyone who wants to work with us in the EU institutions and the national member states. I think we have to break up our bubbles and the one of the others. We're not the only ones living in bubbles. Everyone is a little bit, and trying to get together with all those who want to work towards this different vision. And I think otherwise, looking to the next 30 years, I somewhat, well, I don't want to say I disagree with the commissioner. That's a dangerous thing to say in Brussels with Stella Kyriakides, but I remember things slightly different. I don't remember European solidarity. Of course, there were examples of medical teams going to other countries. There were definitely examples of European solidarity, but what I remember first was closed borders, everyone making its own decisions, even in living in Belgium, regions making their own decisions. And this showed me that nothing can be taken as given. And for the next 30 years, we have to have our vision, we have to be determined, but we have to be very much aware that things like COVID can happen again, that there might also be great things, windows of opportunities that suddenly open up, unexpected. COVID was terrible, but at the same time, a great opportunity for health. So, and for this, we have to be open to all kinds of challenges that suddenly might arise out of nowhere, and we get us totally unprepared, and great windows of opportunity. Jump on them and try to work towards this vision. Thank you.
Thank you. Anne. Did I miss anyone out? You also wanted to speak? Yes. Okay.
And Manuela, I used to work for IFA years ago. And I now work in France for a local collective of people working on HIV and AIDS. When I listened to the conference this morning, I thought, well, it's the EU bubble talking to the EU bubble. I kind of felt indeed that this is the elite. And I used to be part of it. I'm not anymore. And I strived to find the connection between what I'm doing on an everyday basis and what people were talking about today. So I think as a challenge for the public health community is to get together and to get together between the EU bubble and we working at local level. I'm working with some of the people you were talking about earlier. I mean, community workers, nurses, and so on. And I'm not quite sure what I'm going to give them as a brief about the meeting today. So that's for me is a real big challenge. And it's a real big challenge also because when we look at other fights like climate change, we've got activists on the ground. They are the ones that are changing the narrative. The Greta Thunberg and people like that. We don't have that in public health, at least not in the public health community. We will have that in HIV and probably on women's health as well, but not in other issues. There's a big challenge in the next 30 years, I think, in having a community of real people that will know what public health is about, which is then my third point, which is that even clinicians don't know what public health is about. Public health experts know public health. Clinicians, physicians, nurses, community workers, they won't be able to define public health, at least the ones I'm working with. So there's a real issue around outreach because actually they're also part of the public health community. They could be the ones going to see their local politicians, national politicians, and have this kind of bigger view of health. And we're missing on that. And my last point is about scientists. It's great to have articles in the Lancet, in the BMG. Please make sure your data reach politicians. I'm just going to give you an example. I mean, we're working on migrants' health at the moment in France and trying to secure state medical aid for undocumented migrants, which is in danger because of populism. We've got data published 10 to 15 years ago showing how useful it is. The cabinet of the Ministry of Health didn't know about this data. Of course, they could have been looking for that data. I mean, it's over there, but I want scientists to continue their job after having published. Publishing data is great, but getting that across the border to politicians is even better. That's also your job, actually, to make sure that politicians have that information. Otherwise, they won't be able to change their vision and we won't be able to challenge them.
Thank you. One last person at the back. Go ahead.
Yes, thank you very much. So Nora Lorenzo here from European Cancer Organization. I just wanted to raise a point based on this opportunity that COVID gave us and how it was a great opportunity for public health to become more relevant than it was before. But I think that we all are very aware that NCDs have a huge burden of in our society, and it doesn't have such a strong impact as infectious diseases, for example. And I think that it's very relevant that we are able to quantify how oncology workforce, CBD workforce is struggling with that, and that we are not waiting to get to that point where it's unreachable or we are not tackling the issues anymore. So we can really struggle and we can prevent the struggle before, and the healthcare planning, it's really relevant on that point. Thank you.
Okay. Thank you. I'm going to bring this session to a close. I thank you for your passion and your engagement. We have clearly stirred the pot. We have intrigued you. You've given us again a strong message about the critical importance of civil society reflecting on itself and its role, continuous outreach to the front line, the community workers, making sure we are representative, making sure we're listening, making sure we are holding that accountability and bringing the messages up, sharing our power and challenging our own entitlements. So these are all really valuable messages. There's also this idea, make sure we keep an eye on the language that we use, the semantics, they're very important. I'd now like to pass to Alice Chapman-Hatchett, who is the president of IFA, and I don't envy her challenge to wrap all of this up and set out how IFA is going to use this going forward. But Alice, I hope we have given you a smorgasbord of ideas, of passion, of ambition, of hopes, of fears for IFA to take and turn into its movement going forward.